How do stomach cancer blood tests differ for screening versus diagnosis? Imagine trying to catch a hidden problem early or confirming if something is truly wrong. Blood tests play a key role in understanding stomach health, but their purpose changes depending on whether they are used for screening or diagnosis. When doctors think about screening for stomach cancer, they look for ways to find potential issues before symptoms even appear. Right now, there are no blood tests officially approved or recommended for routine screening of stomach cancer in the general population. Instead, screening often involves procedures like endoscopy, especially in people at higher risk, such as those with a family history or certain medical conditions. Blood tests used for screening are generally designed to be simple and sensitive, meaning they can pick up early signs or risk factors, but they are not very specific. That means they might suggest something is wrong but cannot confirm cancer on their own. On the other hand, diagnostic blood tests are used when someone already shows symptoms or when doctors find clues pointing toward stomach cancer. These tests are not meant to diagnose cancer directly but help gather important information about the patient's overall health. For example, a blood test might reveal anemia, which is a low red blood cell count caused by bleeding from a stomach tumor. It can also assess how well the liver and kidneys are functioning, which is important if treatment is needed. A complete blood count test can show abnormalities in blood cells that might be related to cancer or its effects. During treatment, blood tests are also used to monitor blood cell levels because some therapies can affect bone marrow function. It's important to remember that blood tests alone cannot confirm stomach cancer. A definitive diagnosis requires procedures like an upper endoscopy with a biopsy, where tissue samples are examined under a microscope for cancer cells. Blood tests serve as helpful clues, guiding doctors on what further tests or procedures might be necessary. In summary, blood tests for stomach cancer serve different roles. For screening, no specific blood tests are currently recommended, and doctors relying more on endoscopy in high-risk groups. For diagnosis, blood tests help detect signs like anemia or systemic effects, but must be combined with imaging and tissue sampling to confirm cancer. They are supportive tools that help paint a bigger picture of a patient's health rather than standalone tests for cancer detection. Understanding this distinction helps ensure proper clinical use and patient care, emphasizing that each step in diagnosis and management is tailored to the individual's needs. Always consult healthcare professionals for personalized advice and appropriate testing strategies.